though making simple lifestyle changes can significantly reduce cancer risks, studies shows that up to 40% of cancer cases may be preventable. Key adjustments include quitting smoking, which is linked to numerous cancers, and maintaining a healthy weight through regular exercise, aiming for at least 150 minutes of moderate activity per week. A diet rich in fruits, vegetables, and whole grains, while limiting red meat and processed food, is crucial. Additionally, experts say protecting the skin from UV rays can further decrease cancer. These proactive steps will empower individuals to take charge of their health and potentially prevent cancer. Welcome to 30 Minutes on NTA News 24. This edition is interrogating what can be done differently and proactively to mitigate increasing cancer burden. I'm Lydia Sampson. Now, the increasing cancer burden globally necessitates urgent action to mitigate its impact on public health. In 2025, the projection is alarming, highlighting the urgency of effective intervention strategies. This alarming trend underscores the need for comprehensive cancer control programs that prioritize prevention, early detection, and equitable access to treatment. Ibrahim Belogunda has an overview of cancer burden and why it is escalating dramatically.
Cancer remains a leading cause of death globally, with significant disparities in incidence and mortality across regions. In 2022, there were an estimated 20 million new cancer cases and 9.7 million deaths. The estimated number of people alive within 5 years following a cancer diagnosis was 53.5 million. About 1 in 5 people develop cancer in their lifetime. Approximately 1 in 9 men and 1 in 12 women die from the disease. Over 35 million new cancer cases are predicted in 2050, a 77% increase from the estimated 20 million cases in 2022. The rapidly growing global cancer burden reflects both in the population aging and growth, as well as being attributed to changes to people's exposure to risk factors, several of which are associated with socioeconomic development. Tobacco, alcohol, and obesity are key factors behind the increasing incidence of cancer, with air pollution still a key driver of environmental risk factors.
Cancers largely fall under, the kind of conditions you see when people even live older. So there are a number of things. It used to be that the infectious causes caused a lot of deaths in our people. We're going through what is called an epidemiological transition, where more chronic, longer-term conditions is what is killing us now. So even the cancers that are caused by infectious agents, it takes a long time for them to develop and transition to cancers. So when you live longer, you get to experience conditions of age and that are associated with living long. That's one thing. I think lifestyle as well, lifestyle and exposure risk. We all know the effect of environmental pollution, fossil fuel burning, and all of the other things that are associated with causes of cancer. The diets, more and more as people have urbanized, as people have been more prosperous, there's consumption of processed foods and things that have been associated with cancers. But beyond that, there's also, because there's more awareness, people are reporting it more. We are more sensitive. So there's more diagnosis, more screening, more diagnosis. So people are showing up more that have cancers. It used to be what we know is cancer today. In many instances in the past would be attributed to other causes, witchcraft.
A few factors are responsible when you talk about cancer burden increasing. The one is that a lot more awareness and diagnosis is going on. So with a lot of awareness, things people hitherto would have thought there was no reason and they could not ascribe to anything. Now there's a lot of tissue diagnosis being done. After tissue diagnosis being done, there are also things that have to do with improved radiological facilities. And people are now able to identify cases and say that, okay, this one is actually a cancer and a tumor. So when a biopsy is done, previously things that people would have, and there's increased number of diagnoses being made. Increased number of diagnoses being made means increased number of cancers being found. Like we saw in one of the presidential programs that has to do with a lot of screening. The more the screening that is done, the more the awareness that is made, the more people find it easier to come out.
It is also increasing in low and middle income countries as compared to developed nations. It is, yes, you are absolutely right that it is projected to have increased by 2050 to over 35 million cases annually, and that is in low and middle income countries. It is projected that it will reduce by almost 70% in developed countries. And the reasons are not perfect. Number one is late diagnosis and late presentation. Number two is lack of access to treatment. Number three, abandonment of treatments. Number four, lack of screening programs in low and middle income countries. And finally, abandonment of treatments because of financial toxicities.
World Health Organization's Cancer Agency, the International Agency for Research on Cancer, released the latest estimate of the global burden of cancer.
The cervical cancer is one of the commonest causes of cancer among women in Nigeria. There are 12,000 cases, new cases diagnosed every year in Nigeria, and about 8,000 women die from cervical cancer. So it's in fact a condition of public health priority and importance for us. Fortunately, there are things we can do, and the government of Nigeria has prioritized it for intervention. The first thing is really just around awareness, and a lot of effort is going on with the Ministry of Health, the National Primary Healthcare Agency, and even NICRAT at creating awareness around cervical cancer. The other is primary prevention, which is through the vaccinations. As you may be aware, the NPHCDA, under the leadership of the Minister of Health, introduced the human papillomavirus vaccine into the routine immunization program in 2023, in two phases actually. The first phase was in 21 states in October of 2023, and the target for that was to vaccinate 12 million girls, what we call a multi-age cohort, so they aged 9 to 14 years. And very proud to say that in that phase of the campaign, we were able to reach 96% of our target at the time. The second phase was really at the end of May 2024, and we went to the rest of the 16 states, and fortunately as well, we achieved very high targets. Of course, you ask a good question about the acceptability of it. I think there is multiple sides to that. As with anything new and with vaccines, people had a lot of questions, but also because we were targeting a different and unusual population. You have children that are teenagers, which is not who we would typically, girls that are teenagers, who are not typically who we will target with vaccines. There were a lot of questions, but I think we anticipated this. So what we did was to have a very multi-sectoral approach at launching it. We engaged with the communities through the gatekeepers of information, through women organizations, through traditional leaders, but also schools, which allowed us to reach the children, and the Parents Teachers Association. So what that was able to do, of course, we were partnering with you all in the media as well. What that allowed us to do was that we put a lot of the correct information out there, which drowned the mischievous information that was going around, and I think the uptake has been very, very good since then.
More than 50% of Nigerian population is in the youth. So, and we are trying to target the youth. So the number of vaccines that are available to Nigeria is grossly inadequate. We will want to see a situation where about 100 million doses will be available to Nigeria at once. But it's very competitive. The Global Alliance for Vaccine and Immunization, Gavi, is the one that is saddled with the responsibility of providing vaccines around the globe, and is very competitive.
World Health Organization also published survey results from 115 countries, showing majority of countries do not adequately prioritize financing cancer and palliative care services as part of universal health coverage.
Global disparities is all around funding. If you look at the budget of cancer care in developed world and compare it with that of low and middle income countries such as Nigeria, is so meager. It's really like it's not even there. I'll give you an example. the Nigerian government instituted what is called the National Cancer Health Fund that is supposed to cater for 3 important cancers for indigent Nigerians. And you'll be surprised that only about 150 to 200 million was appropriated this year for that fund. And that amount is not even enough to treat 20 HER2-positive breast cancer patients. Only 20.
Presently, the president has approved the establishment of 6 cancer centers, to each one in each of the 6 geopolitical zones. And as a matter of fact, 3 of them are coming up this year, 2025, and another 3 in the next year and in the year afterwards. So so there's a deliberate and intentional investment. Even as a matter of fact, because the president wants things to be rapid, it gives a mandate through the Nigerian Sovereign Investment Agency to midwife the process. So there's the Federal Ministry of Health on one side, there's the National Coast Guard, and there's the Nigerian Sovereign Investment Agency on the other side, to ensure that funding is not a problem.
Despite the early progress made in the early detection of cancers, the treatment and care of cancer patients still has significant disparities in cancer treatment outcomes, not only between high and low income regions of the world, but also within countries.
There's an urban-rural dichotomy when it comes to cancer care. One of the things that we've observed is that majority of those that have cancers in the rural environment, they present late. When they present late, they have worse diagnosis. But most of those in the enlightened and in the cities, they present early and they do better because they have access to more ready quality of care, and more and higher and better improved quality of care than those that are in the rural area.
Since the year 2000, the global initiative to fight cancer has become one of the most significant health campaigns worldwide to raise awareness and improve knowledge about cancer risk, prevention, detection and treatment. 2025 marks the first year of the new unity by a unique campaign which focuses on people-centered approach to cancer care. This campaign represents a fundamental shift in how health and cancer care services are designed and delivered, placing individuals, families, and communities at the heart of the health system.
Now, bringing it closer, Thomas Ogbetere has an update on cancer situations in Nigeria and what is happening to change the narrative, with special focus on prevention. Okay, Thomas, let's have your findings.
Cancer is a growing public health crisis in Nigeria, with over 102,000 new cases and 72,000 deaths annually. In addition to its devastating impact, cancer is often shrouded by stigma, misconception, and limited access to care in Nigeria. In a conversation with Zainab Shinkafi Bagudu, a global cancer advocate, some survivors, medical experts, and other advocates believe it is clear that addressing the cancer crisis requires a multifaceted approach focused on awareness, promotion of early detection, improving treatment access, and fostering community collaboration to effectively mitigate the disease.
In Nigeria, our figures are something in the region of 120,000 diagnosed every year. We know that this is underrepresented. If you compare our population to a country like Brazil, which is of similar size, they record, also thought to be underreported, 400,000 per annum.
It is a disease that can affect virtually every organ of the body. Every living cell of the body can develop cancer, and this is why we have over 200 disease entities that are called cancer. But of course, commonly the most prevalent cancers in our environment, not only in our environment but all over the world, you have breast cancer, cervical cancer, and prostate cancer in men.
Unfortunately, many Nigerians delay in seeking medical help until the disease is advanced due to a lack of awareness and fear of the diagnosis. Experts stress the importance of collective efforts to change these harmful narratives and encourage early diagnosis.
There are some that we can eliminate, like HPV-related cancers, cervical cancer. The vaccine against the particular strains that cause it exists, And again, screening is another measure that we can give ourselves. That is testing for it. The key thing to cancer is early detection.
Nigerians have a very poor health-seeking behavior. That means they normally wait until things have gone really bad before they seek help. So for me, the first step for us to take is for us to encourage parents, adults, everybody in Nigeria to seek help early and to conduct an annual health check.
These breast cancer survivors shared their painful and traumatic journey of initially ignoring a lump, thinking it was just stress, only to find out later that the cancer had spread.
I did a mammogram in 2014. It was free. There was negative, there was no breast cancer, no tumor, nothing. In 2015, I felt the lump. Now, you would think that somebody like me would go and get tested, but I was so busy working, and the reason they call it a silent killer is that it doesn't have any symptoms, none. I wasn't having internal bleeding, I wasn't having external bleeding, I wasn't feeling any pain. The lump was just there, not doing anything. So I didn't do anything. But I felt that the lump was getting bigger and bigger, and yet I didn't do anything. So one day I was at a hospital in Abuja, and I said, you know what, maybe I should do a physical check. So I did a whole physical check, like blood test, and then they said, why don't you do a mammogram? I said, yes, because I think there's a lump there. They said, what? So that was the beginning of my journey. And so I remember going and doing the mammogram, and then getting a little bit scared because it was the moment of truth. When they did a biopsy, the first diagnosis was benign. Benign meaning that it is not cancerous. But I was getting pain under my armpits. And the chief medical director of the hospital, his sister had the same symptom and said, no, we're going to do another test. So it's very important to get a second opinion. So when we did a second test, that's when it came back positive. And I remember the doctor looking at me, and Dr. Mustafa, and he said, Choma, I'm sorry to tell you, but you have cancer. Not only do you have cancer, but you have one of the most aggressive forms of cancer.
So on that day, I felt something as I was having my bath. I was like, no, this wasn't there. And I told my girlfriend, and she said, okay, let's go to the hospital and check it out, which we did. And that was in 2009, actually. And the results came out, and it was benign. It wasn't cancerous. So I was happy. Then 6 months later, I felt another lump, the same place. And I went back to the doctor. When I told him, I called him actually. I asked him, doctor, how long does it take for internal stitches? Because that was what I assumed it was. How long does it take for the internal stitches to dissolve? And he said, is there any problem? I said, yes, where I had surgery before, I'm actually feeling something there. He said, come to the hospital. And I did. When I got there, he checked. He said, oh, it's another lump, and it is bigger than the first. Hey, I cried and cried. Somehow I felt that something was wrong, that it wasn't going to come out good than the last time. And he said, well, this is a private clinic, that he's going to refer me to the National Hospital where I could get treatments. And he referred me to the SOPD, the surgeon. When I got there, the surgeon was like, okay, the way it is, I want you to start with the treatment first before we do surgery. If you start with the treatment, we'll see how far the treatment goes on affecting the cancer cells, and that will determine the kind of surgery we are going to do. And I proceeded to meet my oncologist, I started my treatment. And I did 6 courses of chemotherapy, 25 sessions of radiotherapy. I was placed on hormonal drug for 5 years. And when I was doing my chemotherapy, I noticed that the lump completely dissolved. So The surgeon said instead of taking out the whole breast, they are going to take part of it, which they did.
Experts also emphasized the important role of balanced diet, regular exercise, avoiding tobacco, and maintaining a healthy lifestyle in reducing cancer risk.
Cancer is preventable. It is preventable by general lifestyle measures. We know that there are certain factors that will contribute towards developing cancer. Smoking, overconsumption of alcohol, and some viruses, infectious viruses that are sexually transmitted. This HPV one that I have mentioned, hepatitis virus is another one that leads to liver cancer. And so if we avoid these things and do more of the positive things, right there, we're doing the positive things is diet, the kind of food that we eat, avoiding red meat, eating more of healthy vegetables and legumes, and avoiding unsaturated processed food.
We prevent cancers by ensuring that we maintain regular fitness. We exercise very well. We regulate our eating habits. We avoid the use of patronizing all these junk foods. Most of them have carcinogens in them. You become a natural man by taking enough fruit, enough water, and the natural things in the environment.
They are of the opinion that the Nigerian government has recognized cancer as a national health challenge and is responding with initiatives like National Cancer Control Plan, NCCP, to improve access to care and early detection.
But there is a need to increase the attention, focus, and funding that goes into cancer generally for across the spectrum: prevention, screening, treatment, up to palliative care. Government really does need to provide more funding, better conducive working environments for the healthcare workers. I'm not just talking about doctors. There's so many people involved in cancer care: the radiographers, radiologists, you have the medical physicists, the biomedical engineers. We buy machines. Who is looking after the machines? We have to wait for weeks for somebody to come from Turkey or somewhere else to come and fix the machine. Even to maintain them, we need to sign these agreements, maintenance, and make sure that when the companies sell us these machines, they also grow the industry, they grow the professionals in Nigeria in-house that are going to be able to maintain the machines properly so that they work for the people.
To improve access to care and early detection, key developments include the establishment of oncology centers of excellence equipped with modern diagnostic and treatment facilities. Experts emphasize the need for expanded cancer screening programs to ensure early detection, treatment, and care. It is also heartwarming that government has in place policy reforms such as the proposed National Agency on Cancer Control, which aims to reduce treatment costs and remove barriers to care, including waiving import duties on cancer medications to make treatment more affordable.
Government should make healthcare financing affordable or available to the average individual. Healthcare insurance is one thing that can actually help to reduce the scourge. A lot of us do not have access to this insurance.
As there is a responsibility from NGOs and government to be able to see that we put hands together to be able to ensure that those who are diagnosed with cancers, whether it's childhood cancers, breast cancers, testicular cancers, prostate cancers, that they have a leeway to be able to receive the care.
Once a man is up to 40 years, he should be doing yearly prostate-specific antigen test.
They emphasized the need for collective efforts to reduce the cancer burden in Nigeria, urging the federal, state, and local governments to collaborate on improving access to cancer treatment and early detection.
Awareness, education of groups, sensitizing communities, going deep into our hard-to-reach areas and working with communities, the community leaders, various stakeholders, religious and traditional rulers. We have programs that are focused just on these people so that we can get their buy-in. We know our culture, we know how our people respond. So awareness and education generally. The second thing that we do a lot of is screening. We offer screening. We work with various partners, both locally nationally and internationally.
When there's someone in the family that has cancer, it's something that affects the entire family. Obviously, the different members of the family in different ways. So the person that has cancer is already struggling with an illness that physically affects them, that makes them suffer from pain.
Despite the challenges of cancer, they are on the same page that there is hope in mitigating cancer in Nigeria due to the combined efforts of advocates, healthcare professionals, survivors, and the government.
Stop stigmatizing those who have cancer. Stigmatization has led a lot of people to early graves.
The consensus is that to reduce the impact of cancer in Nigeria, it is crucial to get regular screening in addition to maintaining a healthy diet rich in fruits and vegetables.
Collectively addressing these identifiable challenges will not only improve survival rates, but also alleviate the economic strain on healthcare systems. Therefore, investing in cancer prevention and treatment is essential for fostering healthier population and ensuring that future generations are less affected by this devastating disease. Thanks to our respondents for sharing their insights and our viewers for their time and feedback. Next week, God willing, we'll be back with another critical issue. Until then, take a bold step towards a better lifestyle change to reduce cancer risks. I'm Lydia Sams.